Thank you. Senator Williams.
Thank you, Madam Acting Deputy President. And I rise tonight to speak about a very vital business, especially in many small regional towns, Madam Acting Deputy President. I talk about the local chemist shop, the pharmacy, and what a vital service they are. Madam Acting Deputy President, the Nationals stand up for small business, and many on this side, of course, do that. We're very proud of small business and what they contribute to our country. Recently retired Senator Ron Boswell led the fight to protect our pharmacies in the face of competition. He fought to ensure pharmacies remained as standalone businesses. And we need to continue this fight, Madam Acting Deputy President. From both sides of Parliament, we've seen cut after cut after cut to our pharmacies. And I've spoken to many of them in recent times. I've seen pharmacies close down. We even hear of pharmacies now going into receivership. It is a real concern. Madam Acting Deputy President, there are negotiations coming up with the government, and I urge the government to be fair. Life is about fairness. The name of our national anthem, Senator O'Sullivan. Advance Australia Fair. I underline fair. 5,350 community pharmacies in Australia employ around 60,000 staff. 30% are in regional areas, 12% of them are in rural and remote areas. 425 Australian towns have one pharmacy. I'll repeat that, 425 Australian towns have just one pharmacy. Sometimes it is the biggest employer in that town. People in rural and remote areas are more likely to have a health problem such as obesity, heart disease and high cholesterol. And we can throw blood pressure in with that. It is a fact that people in rural and remote areas live shorter lives and have higher rates of disease and injury than people in major cities. They are also more likely to skip GP visits, tests and medicines because of cost. PBS reforms are adversely impacting on pharmacies, Madam Acting Deputy President, have been for many years. I'll give you a quote. Peter Crowthers of Towers Pharmacy at Burke explains in his words the problems. Let me quote what he said. As a result of the price disclosure impact, we have not replaced one departing full-time staff member and will be putting off another part-timer. He goes on to say we already have high unemployment in Burke, especially youth unemployment, and the social problems that accompany this like drug and alcohol abuse and domestic violence. There are gaps in Aboriginal pharmaceutical programs such as the S100 and QMAX, which is quality use of medicines maximised. In our area, QMAX does not apply and S100 does not subsidise the cost of dose administration aids. Just to explain what S100 is, Madam Acting Deputy President, it is an allowance that is paid to approved pharmacies and approved hospital authorities for the provision of a range of quality use medicines and services to patients in approved remote area Aboriginal health service areas. Peter continues, that means Aboriginal people requiring these doses have to pay for the service. We charge $6.50 per patient per week, which is about half, I repeat half, of what it costs us to do them. And we pick up another $1.50 or so per pack from the 5 CPA incentive payments. $6.50 is the absolute limit of people's ability to pay, but now we will have to increase it. Unless other agencies pick up the tab, people will drop out of dose administration aids. That is a part of what Peter Crowthers had to say from Towers Pharmacy in Burke. It is estimated that PBS reforms will have an impact of $450 million this year, which is $90,000 per pharmacy. 10% of staff will be shed over the next 12 months, reduced services and cut back in opening hours. Total government savings from reforms will reach $20 billion by 2020. $20 billion to that industry by 2020. Payments for prescriptions will be less in 2020 than 2010. Pharmacies need to broaden their horizons to survive. A 2013 Grattan Institute report found that more than 1 million Australians who live in regional areas are denied access to basic medical care that most city dwellers take for granted. It identified 7 areas containing 1/20th of Australia's population where limited access to GPs is imposing severe costs on individuals, doctors and the health system. Those areas include Tamworth, Goulburn and Mount Isa, as well as most of the Northern Territory and Western Australia. It found that in these areas severe GP shortages continue to exist regardless of the policies that have been implemented. Perhaps pharmacies can fill some of that void, is the message. The sixth agreement between the government and the Pharmacy Guild will most likely start in July next year, and it needs to maintain, where possible, enhance existing regional programs. The Pharmacy Guild points out that their members are increasingly being asked to deliver more services to an ageing population, such as health checks, vaccinations, pain management, wound care, mental health management and even sleep apnea. There are many issues that the Guild would like to see included in the next agreement, but there are three essential requirements. Dispensing remuneration must be maintained in real terms, a transparent funding model to offset the impact of lost trading terms on core pharmacy services such as home deliveries and health checks, and a comprehensive medicines adherence and medication management strategy. Madam Acting Deputy President, we must ensure that our pharmacies remain viable. I've seen my local pharmacies. I've seen where we used to have 5 pharmacies in Inverell where I live, population 12,000 in town, bigger shopping area of population of course, reduced to 3 now. My mother in her early days of dementia, the Webster packs were put together. It was clear what she had to take each day for her medication. The local pharmacy is a place of trust. People go in to seek advice, whether it be cold, flu, aches, pains. You go in there with total trust for what the pharmacy tells you. You trust the pharmacy, you know they do their best for you. And Madam Acting Deputy President, I don't want to see any more pharmacies close their doors and people being put off. So we have to consider the future of these small businesses as we progress through this agreement. It is vital that pharmacies remain viable financially. They're there to do their service, and of course they're now relying on delivering more services, such as blood pressure tests, such as diabetes tests, you name it. It is becoming a one-stop shop for many in very, very small communities where they may have to wait for weeks to see a doctor. In some communities, sadly, we do not have GPs. So I encourage us in government to see that we do the right thing by our pharmacies in this new agreement. They've suffered billions of dollars worth of cuts over many years. I mean, the general impression was, you own a chemist shop, you own a pharmacy, you're a millionaire. That is not the case. I know it is not the case. The people I know and trust have told me, we've gone through the figures. They are putting people off, and they do have to remain viable. So I encourage us in government and the ministers and the Treasurer to see that we do the right thing, this new agreement with our chemist shops.